There's also something called an appendix testes, which is kind of like a little finger-like projection on the testicles. Sometimes there can be inflammation of the appendix testes, but the only way to know exactly what it is that is causing the pain is to do an ultrasound.
So it's a new week, and that means new content from Pediatrics to go. So today we're going to talk about, actually Dr. Sanusi is going to enlighten us about testicular pains in children. So here we go. Or here's your cue.
Hi, Francisca. Testicular pain is something that is an emergency. When we have boys coming in and complaining about testicular pain, especially if it's been within 24 hours, the reason it's an emergency is because we worry about torsion of the testicles. Just remember that the testicles are kind of like hanging like a fruit, and it has a stalk. And that stalk has blood vessels that connect with nerves that connect to the testicles. And the testicles are useful for reproduction. That's where the sperm is produced and stored. So if a child is coming in and complaining about testicular pain, we have to have them go to the emergency room. And the reason is we need to have them do a Doppler ultrasound to make sure that the blood flow to the testicle is not compromised. If there's torsion of the testicles, that means that the stalk that holds the testicles has been twisted and there's no blood supply to that testicle. And that testicle can die if it's not repaired, usually within as quickly as possible, but within 24 hours. Once there's a twist and there's a decreased blood flow to the testicle, then that testicle can end up dying if it's not fixed. So that's why it's an emergency, and we recommend. Some people are just born with genetic predisposition to have the testicle twist, and the testicle by itself, remember I told you, is like how you see mangoes on a tree with a stalk. Sometimes the testicles are swinging freely in individuals, and it's something that they were born with. But one fateful day, they might have that whole stalk twist on the testicle. And anytime we have pain in the testicle for any little boy, big or small, it's always better to check it out. Now, we send a lot of patients to the emergency room to get ultrasound with Doppler flow, which is an ultrasound that they push in a dye into the veins, and that highlights the blood flow to the testicle. So if an ultrasound is done and the testicle has good blood supply, then other things can be looked for. Some boys might have an infection of the testicle. If an older boy is sexually active, he might have a sexually transmitted disease of the testicle, and those are easy to take care of. You give antibiotics, you give the medicine that is needed to kill those bacteria, and everybody is happy. There's also something called an appendix testes, which is kind of like a little finger-like projection on the testicles. Sometimes there can be inflammation of the appendix testes, but the only way to know exactly what it is that is causing the pain is to do an ultrasound. Once you do the ultrasound and you rule out testicular torsion, now if the child has testicular torsion, that's a surgical emergency. They need to go to the emergency. They need to call the surgeons, pediatric surgeons or urologists, whoever is available and can do it, needs to go in there. And what they do is what we call osteopexy. They basically stitch the testicle down to the scrotal wall so that the testicle is not swinging freely anymore. Okay. And that takes care of that problem of testicular torsion. Wow. And as long as it's usually within 24 hours that the surgery is done, that testicle is saved. If it's not diagnosed on time and the surgery is not done on time, testicular torsion can end up being a problem, because if a boy loses one testicle, that means he's only going to have one more testicle, and at the end of the day, he might have infertility as an older child, as a grown man. So anytime little boys or teenagers, any male in general, anytime a male has testicular torsion, especially if the pain is so severe where they are vomiting, because when some children have, or teenage boys have this testicular pain, it can be so severe that they throw up and they are screaming in pain. It can be extremely painful. Wow. If it's not testicular torsion, most times it's an infection, or it could be, on a rare occasion, it could be cancer of the testicles. Wow. Most of the children who have cancer of the testicles, though, it's not acutely painful. It's something that is insidious, and most times it's not painful. But when there's testicular pain, always go to the physician so that they can check you properly and make sure that you do not have a testicular torsion, which is the worst thing that can happen.
Wow, that's scary.
It's not scary as long as you know that it's something that to take as an emergency and you want to go to the ER or to a hospital where there's a urologist or where there's a pediatric surgeon that can take care of that emergency. See your pediatrician or see your regular GP. They'll be able to transfer you to the place where you can get the care you need. So that way it's not a problem.
So from what age, like, can you detect it, like, for...
It's interesting. Most little boys will tell you that, that they have pain in their testicles.
Like like babies, or just like when they grow?
No, little boys that can talk. But some babies will just have, like, they scream and scream and scream. And when you do an exam, sometimes you might see a darkening of the testicle on one side. It's not very common, though, but it's been diagnosed in the past. And you just do an ultrasound and there's decreased blood flow to the testicle on that side. And once you do the surgery, most times you can save that testicle. Wow. Yeah. But when you have a baby that is crying, and you can't see what's going on, examine them from head to toe. They can't tell you what's going on, but sometimes the testicle that is inflamed the scrotal sac on that side will be a darkish color. It will be darker than the other side. And they won't want you to touch it. There's something called guarding.
Guarding you.
They'll be guarding, like, no, go away, don't touch it. And when you touch it, it's so painful, they scream. Wow. And the parents will tell you that he doesn't want us to wear his diaper, put his diaper on because it hurts. But that's not very common. It's commoner in older children. And if they tell you that, I have pain in my testicle, please take it seriously. And doctors need to take it seriously too, so that the child gets the care that they need. Do an ultrasound with Doppler flow, and that will determine if there's blood flow to the testicle. And as long as there's blood flow to the testicle, everybody's fine.
Oh wow, that's very, very informative. Like, I feel like most mothers should like watch this, because I think we kind of neglected lots of like things here in Africa, especially, and just as
we're getting better.
But
we're getting better.
It's
improving.
Yes, that's true. So anyway, thank you very much for listening. Our online viewers, thank you so much. And if you've gotten to this point in this video, don't forget to subscribe. And in case you need pediatric like care, and this is where Dr. Sanusi comes in for her calling action. What do you call
to action?
Call to action.
We'll be happy to see you if you need to be taken care of at our facility in Lagos, Pediatric Partners Hospital. You can Google it, pediatricpartnersng.com. And if you need to call us, all the information is on our website. Thank you.
So until next time, bye.
Bye.